Namaste students, myself Dr. Kumar Rathod, Assistant Professor, Department of Kumar Pritya, Faculty of Ayurvedic Science, Jyoti Vidyapeeth, Women's University, Jaipur, Rajasthan. Students, today's topic is anemia. So start with the introduction. So what is anemia? It is the main major question is what is anemia? So anemia is a major killer disease in India. Statistically reveal that every second woman in India is anemic. So one is every 5 maternal death is directly due to anemia. Anemia affects both adult and children of both sexes. Although pregnant women and adolescent girls are most susceptible and most affected by this disease. So it is important in adulthood or starting with the childhood, anemic patients has to be treated. If give any kind of supplements that treat anemia. So what is the contain in this session we will read. So it is important to know. We will start with the definition of anemia, basics about RBC, classification of anemia, anemia's causes, anemia sign and symptoms, lab investigations of anemia, any kinds of some treatments and preventions protocol we have to start in this prevention. Uh, so start with the anemia. So anemia means normal amount of red blood cells. If the amount of red blood cells is decreased, so the patient is called anemic. ठीक है, इसमें बताया गया है anemia start with the name like N means without, emia means blood. So decrease in the number of red blood cells or less than the normal quantity of hemoglobin in the blood is condition called anemia. So decrease RBC and less amount or normal amount, less than the normal quantity of hemoglobin in blood, it's called anemia. So start or something know about and try to understood you what is the RBC and what is the relation of RBC to anemia. Mature red blood cells are flexible and concave disc like resemble a soft ball compressed between two fingers. 2.4 millions new erythrocytes are produced per second. So it has a diameter about 8 micrometers and it is flexible than it can easily pass through our capillaries. So then the membrane of RBC is very thin so that gases such as oxygen and CO2 can be diffused easily across it. So mature erythrocytes have no nuclei or immature RBCs is called reticulocytes. Mature erythrocytes has no nuclei. It is an important question for PG exams. And immature RBCs is called reticulocytes and its lifespan is 120 days. RBC production process called erythropoiesis. In erythropoiesis process, the most common important hormone participates in erythropoietin, which produced by kidney. The entire process of erythropoiesis typically takes 5 days. You can see in this figure, it's a arteries or vein, and then its bifurcation is capillary. So the thin membrane of RBCs, it can be passed out from the capillaries also. It is the production of RBCs called erythropoiesis. It is RBC, red blood cells, increase RBCs production. So lack of oxygen, so hypoxias may be there. So kidneys increase the red blood cell productions called erythropoiesis. So in bone marrow increase their production and formation of RBC. So it is the cycle of erythropoiesis. Now, some terminologies about RBCs, WBC, MCV, MCHC, that is called blood indices. So some kinds of blood indices is, first is MCV. MCV means mean corpuscular volume. So mean corpuscular volume is measuring or measure of the average RBC size. Allow classifications like MCV is called 10 into HCT percentage upon RBC count. RBC count in millions per mm cube. So the normal range of MCV is 80 to 99 femtoliter. So it is important, it is the most important question, MCV range. 80 to 100 femtoliters. It's also try to remember. Then second is MCHC. MCHC means mean corpuscular hemoglobin concentration. Mean corpuscular hemoglobin concentration measure the concentration of hemoglobin in a given volume of packed RBC. Means 32 to 36 gram per DL. So MCHC is hemoglobin upon HCT. Third is MCH, mean corpuscular hemoglobin. Mean corpuscular hemoglobin means cell of hemoglobin, average mass of hemoglobin per red blood cells. MCH equals to hemoglobin upon RBC, that is come out mean corpuscular hemoglobin. So the normal range of MCH is 27 to 31 picogram per cell. Picogram per cell. WHO grading for anemia, grade 1 mild anemia when hemoglobin is 10 gram per DL, or grade 2 any moderate hemoglobin 7 to 10 gram per DL, or severe anemia below the 7 gram per DL hemoglobin concentration. So it is the main important classification about anemia. Anemia classification on the basis of cause or on the basis of morphology. So on the basis of cause, it is three types: blood loss, inadequate production of normal blood cells, or excessive destruction of blood cells. And the other hand, on the basis of morphology. On the basis of morphology, it's a three type also: normocytes, microcytes, and macrocytes. So on the basis of causes, first is hypoproliferative resulting from destructive RBC production, hemorrhagic resulting from RBC loss, and hemolytic anemia resulting from RBC destruction. So it is important to know hemorrhagic and hemolytic. It's some kind of different. Hemolytic, lytic means less, destruction form of RBC, and hemorrhage means loss. If the blood loss, then it is important blood, including blood with RBC is also lost. So it is called hemorrhagic. So hemorrhagic form is for blood loss. If have any kinds of accidental of, if patients having, female patients have menorrhagia, so hemorrhagic form occur and blood loss is also occur. So RBC losses and then causes for the anemia. So on the basis of morphology, it's a three type: microcytic, macrocytic, and normocytic. So I told you MCV. MCV cell means the normal structure of RBC. So if the cell is smaller than normal, means normal value is 80 to 99 femtoliter. If RBC size is less than 80 femtoliter, so that is mean, if RBC, that is mean RBC is in microcyte, in micro in shape, so that's called microcytic anemia. And if RBC is larger than normal, over than 100 femtoliters, that's called macrocytic anemia. And if it's a between 80 to 100 femtoliters, that is called normocytic anemia. So in the next, we will talk about microcytic anemia. So microcytic anemia, it's occur in iron deficiency. It is important. Microcytic anemia occurs in iron deficiency. So insufficient RBC production or result hemoglobin synthesis failure or insufficiency, So smaller than normal, under 80 femtoliters. So causes iron deficiency anemia and globin synthesis defect like thalassemia. In all these type of anemia, RBC shape smaller than normal. So that's called microcytic anemia. And macrocytic anemia, it's abnormal than large RBC. Cells are larger than normal, over 100 femtoliters. So it's occur as nutritional deficiency, vitamin B12, folate or protein deficiency. It's also occur due to drug toxicity or any kind of liver disease or alcoholic liver disease, hypothyroidism, in chronic hemolytic anemia or leukemia or gastric bypass surgery. If we observe patients RBC, we find that we will find that microcytic anemia may be there. And the third is normocytic anemia. Normocytic anemia, overall hemoglobin level are decreased, but red blood cell size is remain normal. So it is normocytic anemia. It is in causes by acute blood loss, hemolytic anemia, or aplastic anemia. In this type of cases, patient RBCs will be in normal in size and shape. A normal size and shape is about 80 to 100 femtoliters. So it is type of anemia. It's about to due to blood loss or due to hemolytic or aplastic anemia. So it is a three types of shape. It is the three type of on the basis of size and shape of RBC. Here is the types of anemia: hypochromic, normochromic, and hypochromic. It is based on hemoglobin concentration, and it's all about this type: microcytic, macrocytic, and normocytic anemia is also may be there. So what is the causes? Important causes is increased requirement, increased loss, decrease intake, or decrease absorption. So increased requirement is menstruating female, pregnancy, lactating women, or growing infant or child, erythropoietin treatment, or GI loss, menorrhagia, persistent hematuria, intravascular hemolytic anemia, regular blood donor, or parasitic infections may be cause anemia. And decrease intake if the patient is only on vegetarian diet, socio-economic status like PEM disorders, and decrease absorption if any kind of pathology in GI, gastrectomy, or any kind of antacids and genetic, if patient is regularly basis intake, so anemia may be there. So pathology. In this pathology series, decrease in RBC, hemoglobin, and HCT level, diminished oxygen carrying capacity. So hypoxia may be there, and hypoxemia induced effect on organ function. So sign and symptoms of anemia may be there. So investigations, we will perform CBC and thoroughly evaluation of the patient and physical examination and medical history we will take. So some kind of tests like CBC, stool hemoglobin test, PBS like peripheral blood smear test, iron level, transferrin level, ferritin level we will check, folate, vitamin B deficiency we will check, bilirubin, lead levels, hemoglobin, reticulo count, LFT, RFT, and bone marrow biopsy we will check in lab test. So quantity parameter and quality parameters may be there. So quantitative parameters, we will check PCV in example hematocrit, hemoglobin concentration, red cell concentration as per unit volume, and quality parameters like MCV, MCH, MCHC means blood indices we have to check. And it's a normal value of blood indices, RBC, MCV, HCG, which I told you earlier in this PPT. Here is the some kind of vitamin B12 deficiency, serum iron, serum bilirubin, SGOT, SGPT. It is important SGOT, SGPT full form in several many examinations, PG examinations, SGOT, SGPT full form has to be asked in many questions. So SGOT, SGPT is serum glutamate pyruvic transferase, serum glutamic oxaloacetate transaminase, and hemoglobin and total blood count we have to be checked. So sign and symptoms is very important, showing in the figure. Brittleness, koilonchia, atrophy of papilla of tongue, angular stomatitis, brittle hair, dysphasia, glossitis, plumber vision syndromes, like that. Koilonchia in the normal, koilonchia and blue lines. It is the symptoms of anemia. Angular stomatitis, splenomegaly, anemic of eyes, pallor. So in this series, and the next one we will talk in uh, next session. In this session, I will talk about what is anemia, what is the sign and symptom, what is the type, and what is the classification of anemia. So in the next session, we will talk about many kinds of iron deficiency and many kinds of anemia. So that's all for this session. If you have any kind of query, you can ask me in below comment section. I will try to resolve your problem. So thank you so much.